Hi, my name is Dr. O from E&S Orthodontics, and I want to welcome you to our Friday Focus again. And this week, what we're going to do is answer another frequently asked question, and that question is how long do braces take? And this is a really interesting question because I think it's one of the most asked questions when a patient comes into the office for their initial exam. And unfortunately, I can't give you a direct response. I can only give you an average. And so typically what we see is, depending on the severity of treatment, I can give you, or Dr. Saavedra can give you, a better estimate of how long that would take. But normally, what I would say is it really depends. A normal, not too severe case usually takes anywhere from 18 to 24 months. If we are doing treatment in two stages, where we do a phase 1 stage and a phase 2 stage, typically your expectation should be, in our phase 1, it should be about 12 to 18 months. And then usually in part 2, which would be phase 2, would be another 14 to 18 months. If we're doing what we call comprehensive treatment, where we don't break out your orthodontic treatment into two parts, in our office, our typical range is about 14 to 18 months for less complex cases. And for complex cases that may or may not involve extractions or some other types of appliance, usually it's about 2 years. If we are doing treatment that requires growth correction, which is where we maybe need to help manipulate the lower jaw forward, that typically takes about 2 years. And so in our office, if we were doing herpes therapy, that would be about 2 years, maybe 2.5 years. And so really like I said, there's multiple answers to this question, but usually how long do braces take really is an individual question, and there's individual variation. And so another thing that people always ask is, do teeth move exactly the same in children as they do in adults? The good part is teeth move. They are just dumb little entities, so if we put a force on them, they will move. In children, what we see is the orthodontic movements occurs a little bit quicker than it does in adults. So adult orthodontic treatment, the only difference is it sometimes takes a little bit longer time, but for the most part, we can give you a good estimate what that looks like. Now what we're doing, there's a couple different techniques that help speed treatment along. And those things are case-by-case basis, but there are things that we do in the office that would help advance or make treatment go a little bit faster. And so those are things that we could discuss with you. Now, in terms of the traditional amount of time that a normal Invisalign case takes, it usually takes about 12 to 14 months for that. And again, we can actually do we can do what we call accelerated Invisalign treatment if we apply a device called Accel-A-Dent to that. And so that could actually reduce the time by about 50%. And so there are different techniques that we use in the office that allow us to help speed treatment along. But like I said, each person will vary depending on their age and then depending on the severity of the problem. So I hope this just gives you a brief overview of the question of how long do braces take. And then if you have any questions or any concerns, please give us a call, and we will be happy to answer those questions for you. We look forward to seeing you again in one of our Friday Focuses. This is Dr. O, and we'll see you next week.